Have you ever stopped to think about how a surgeon practices a life or death procedure for the very first time, or, how a paramedic gets ready for a massive trauma call before they're actually in the field? Well, we're going to dive into that because the answer is hidden in a world that most of us never get to see, a world run by some of medicine's greatest unsung heroes.
I mean, just think about that for a second. It's this huge paradox at the very heart of medical training, right? You absolutely need hands-on practice to get good, but your first try can't be on a real person. So what do? How do you solve that?
And here's the answer: medical simulation. This is this incredible high-tech world where doctors, nurses, and first responders can practice, make mistakes, and perfect their skills in a totally safe and controlled way. It all happens here, long before real life is ever on the line.
Now, at the very center of this world is a professional you've probably never even heard of. They're called the Simulation Operations Specialist. Think of them as the directors, the engineers, and the special effects wizards of medical training, all rolled into one amazing job. And pay close attention to that definition, because that blend of skills is everything. An SOS isn't just a tech guru who knows how to run a fancy mannequin. They're a specialist who truly gets the biology behind the technology. That's what makes them the absolutely essential bridge between the simulator and the science.
And that really brings us to the core of what we're talking about today. Why is it so critical for someone in such a technical role to have a deep, deep understanding of human biology? I mean, why can't they just be a brilliant IT expert?
Well, at the end of the day, their medical knowledge is what makes the whole thing feel real. For instance, if a student gives the wrong drug, the SOS has to know exactly how the body would react, how the heart rate should change, what the blood pressure should do, and then make the mannequin do it. They don't just troubleshoot when the machine glitches. They troubleshoot when the machine's physiological response isn't true to life.
This quote just nails it, doesn't it? Their entire job is to be the translator, to bridge that gap. Without their expertise, all you've got is a very expensive, sophisticated doll. But with them, you have a powerful educational tool that genuinely helps save lives.
All right, so what do they actually need to know? Let's do a super quick crash course on the 11 core body systems that every single simulation operations specialist has to have down cold. This is the bedrock of everything they do.
Okay, first up, you've got the basics, the architecture, the skeletal and muscular systems. But where the real action is for an SOS is in the cardiovascular and respiratory systems. They have to be able to simulate everything from a heart attack to an asthma crisis, making that mannequin's vitals react with perfect, convincing accuracy.
Then you've got the body's command and control systems. The nervous system is all about those instant reactions, like programming a seizure. And the endocrine system? That handles the slower, hormonal responses, like what happens in a diabetic emergency. The SOS has to be a master of both to build these really complex, multi-system scenarios that feel real.
To round it all out, you have systems like the immune system, which is crucial for simulating something like a severe allergic reaction, and the integumentary system, that's the skin, for creating believable wounds. But here's the secret. It's not just about knowing what each system does on its own. It's about understanding how all 11 of them work together, especially under stress. That's the key to making a simulation truly believable.
So how did they actually do it? How do they take all that biological knowledge and turn it into a training experience you can see and feel? Well, this is where the magic really happens. They take their deep understanding of, say, the heart and lungs, and then they apply it using their technical toolkit, programming the simulators, adding sound effects, and mapping out the entire scenario from start to finish.
So let's go ahead and open up that toolkit and see what's inside. How does a simulation operations specialist make a plastic mannequin sweat, bleed, and react just like a living, breathing person?
It's this amazing mix of cutting-edge technology and good old-fashioned artistry. You've got the high-fidelity simulators, of course, but then you have something called moulage. That's literally using makeup and fake body parts to create shockingly realistic wounds and injuries. They even use trained actors to play panicked family members. They stage the entire room, down to the last detail, to create this feeling of complete immersion.
And seeing all of that, the tech, the artistry, the biology, it all brings us to one final and I think most important point. As incredible as all this technology is, it's pretty much useless without the human expert who's pulling all the strings.
Look, here's the bottom line. A simulator can show you a dropping heart rate. That's the how. But it's the specialist who understands the why. Is it because of a drug reaction? Is there internal bleeding? They're the ones who build the what-if scenarios that truly push a student's critical thinking. The technology is the instrument, for sure,
but the SOS is the artist.
So I'll just leave you with this to think about. We live in a world where technology is just moving at a dizzying pace, and we tend to focus on what the machines can do. But in a field like medicine, where the stakes are so incredibly high, as our tools get smarter, doesn't that make the brilliant human mind needed to guide them more vital than ever before?